Well, good morning, everybody. It is Valentine's Day. It's Black History Month, but we're also still living in the midst of a pandemic. And so I thought it would be a great opportunity to follow up and have another conversation with our very own Dr. Neil Powe. If you remember, we spoke with him instead of a sermon back in late July. And now we're kind of doing a follow-up because there's a vaccine out and all that, but there's still probably a lot of questions. I know I'm excited to ask him questions about all that. So Dr. Powe, welcome and thank you for being here.
Thank you for having me. It's wonderful to be among my church family.
Yeah, oh, that's so great. So I first wanted to start by saying that it seems like from the data that the people pursuing the vaccination or the vaccine in the African-American community, the rates are lower. And I just wanted to acknowledge that there are historical reasons for that. The medical community, the government, giving African-Americans significant reason to not trust them. So I want to acknowledge that that's a reality and just say, yeah, that kind of makes sense. But now we're in a different time. And what would be your 2-minute sales pitch to convince people to get the vaccine?
Yeah, so I would encourage everyone to read a op-ed that was published last week in the New York Times. I was among 60 Black leaders of the National Academy of Medicine that wrote an op-ed urging all Black Americans to get the vaccine. There's a lot of vaccine hesitancy, but I can tell you this, that, COVID has become the #1 killer in the United States, above heart disease and cancer. And there's a lot of fear to get the vaccine, but there's a lot more fear to get COVID and to die of COVID. So that would be my pitch. We don't need another preventable death to happen, in the country, and particularly among the Black and African-American community.
That was a great pitch. Did you get the vaccine?
I did get the vaccine. I am all vaccinated and hopefully protected. But I'm still being cautious. One of the things that we don't know is whether people who are vaccinated can still carry the virus and transmit that to other people who are not vaccinated. So we've got to be careful for that. It's probably okay for people to gather together who have all been vaccinated. But even if you've been vaccinated, you may protect yourself, but you may pass it on to one of your loved ones, or family, friends. So we've all got to be cautious, really, and that's why I'm continuing to be cautious, to wear masks, to physically distance, and do all the things we've been doing over the last almost a year.
That's great. And how important is it to get the second shot? You have to get 2 shots, and how important is the second one?
So that's a bit of controversy. There is immunity after the first shot of the vaccine, but it doesn't reach the levels that we hear about 95% protection. And that's what we really want. Whenever even we give a medication or any other thing, we want to follow the rules that science set up. And the rules in the trials say that you should get 2 doses of the vaccine separated by a few weeks. So we should follow those rules. I think if we don't, it will be less effective than if we did.
That's great. So if we want to get back to not wearing masks and socializing and being back in church, the best thing is for people to get both shots. That's great. Yeah. Now I've heard, and one of my other questions was, if we get both shots, then does life just go back to normal? And it sounds like you kind of already answered that, as like you still might be a carrier. So if you're around people who aren't vaccinated, that's, you know, not a great thing. Is there any other thing? Yeah, that was a great answer. So I don't have any follow-up, I guess. And again, I'm a priest. Science was like my worst subject in school. So I hope I ask good questions. But I've heard about the COVID-19 is kind of changing and you get these variants. Is the vaccine still effective even as the pandemic, even as COVID changes and we get these variant strains?
Yeah, so this is an interesting thing, and it's something that's a little scary. There are two variants. That one was circulating in the UK, and another one I'm just blocking on where it's from. And then there's a third variant from South Africa. The variants other than the one from South Africa, we know that the vaccine is actually effective against those variants. The one from South Africa, there's some question about that. But what we would think from just the science is that even though the variant in South Africa, you might get it, the vaccine would still prevent you from getting serious illness and potentially dying. So the vaccine would probably have partial immunity for that variant in South Africa. So that's no reason not to take the vaccine, because it will likely prevent you from getting really seriously ill, if not from getting COVID-19.
That's really good news. Yeah, it seems like even if we don't know 100% about the South Africa, it's like everyone needs to get the vaccine and stay safe and wear the mask. I think that's great advice. Yeah, so in your estimation, I know this is all just guessing, but say the vaccine keeps rolling out, we keep doing our best and all that. When do you think we could possibly meet back in church inside and singing and being like we normally were?
Yeah, so this is hard. It's hard to say. We could still see some outbreaks in the community. Luckily, what we've seen over the last few weeks here in the Bay Area is that the number of cases is going down. And that's really good news. And that's the reason for the relaxing of all the health orders in terms of opening up, and also the huge discussion about opening up schools. So I think it's somewhere around 10% of the people in the country are vaccinated. Really, to get where we need to be, we need to have 75% of the people vaccinated to get what we call herd immunity. And so we have a long way to go, but as you know, help is on the way. You've seen all these mass vaccination sites being set up at the Coliseum, over in San Francisco at the Moscone Center. And that's really good. It actually reminds me in the 50s when we had the polio vaccine came out, and I went to the local school to get my polio vaccine. And people were lined up around the corner, and my parents took me to get that. So that's what we're seeing now. We're really gearing up to get everyone vaccinated. So I think over the spring, I would guess that we might be able to safely gather somewhere, I'm going to say in a couple, 2 to 3 months. But here's the thing. We may have to restrict this. So like only if you're vaccinated might we come to church. Should we fill the church, or should we have a lottery for who should come to the church? So those are things that we might do to try to be able to gather at least partially. But we'd have to all accept those kinds of rules, if we are to do that. I think it'll be well into the summer before, things are really going to completely open up.
Yeah, that's a great, I mean, I don't have knowledge like you do, but my birthday is in September. And in my mind, I'm like, I don't think we'll be in church till at least my birthday in September, but what you're saying is great. There's two main vaccines going on. Is there a difference or a preference between getting one? I know I have Kaiser insurance, so I'm just going to, when I'm eligible, I'm just going to get whatever Kaiser is going to give me. But is there a difference between the Pfizer or the Moderna one?
So there is very little. There's a little difference in how they actually work to get you immune, but there's no real difference in the efficacy or in the side effects of those. You may know that there's a young Black woman scientist, 35 years of age, named Kismia Corbett. She was one of the scientists that helped develop the Moderna vaccine. Really, amazing young woman, really at the forefront of science. And I think that's really good, because it sends a message that this was developed by someone in our own community. But I would say, get the vaccine that you can get first. That's what I would say.
Yeah, that's awesome. And because it's Black History Month, I feel like that's sort of Black history being made right now. So can you say her name again? That's so great.
Her name is Kismia Corbett. And she is a scientist who was at University out of North Carolina, who works at the National Institutes of Health in Tony Fauci's institute.
All right, Kismia Corbett. That's fantastic. And then talking about Black History Month, I was wondering if you had a figure from Black history that wasn't necessarily well known that you wanted to talk about, or maybe a mentor that helped you out in your journey to getting to where you are today.
Yeah, so that's really hard, because there were many who helped me, and I think three individuals I would say that were amazing individuals. The first was a guy, Dr. Ed Cooper from Philadelphia. And I met Dr. Cooper when I was doing my residency. I was one of two African Americans in the internal medicine residency. And Philadelphia General Hospital had just closed as I was doing my residency at University of Pennsylvania. And there was a guy, Ed Cooper had been the chair of medicine at Philadelphia General Hospital, and he came over to the University of Pennsylvania. And little did I know, he was watching out for me. And in fact, when I went for, Ed Cooper was an amazing individual. He's the first African-American to be president of the American Heart Association. Really, really amazing, and all these mentors went to historically Black medical schools, either Meharry or Howard. Well, Ed Cooper, when I was going to Johns Hopkins, my first job, Ed Cooper said I had to meet a guy named Roland Smoot. And Roland Smoot, I found out, I met him within 2 days of me arriving there, was the first African-American that was allowed to practice in the clinic at Johns Hopkins, and the first Black faculty member. And I really credit Roland for giving me the landscape of that institution. And I would never have been the first African-American to reach full professor, which Roland didn't even do in the history of the school. But Roland guided me in so many ways and was a sponsor. The third is an individual named Jerry Thompson, very similar to Dr. Cooper. And Jerry Thompson was the chair of medicine at Harlem Hospital in New York, another institution that provided care to the underserved in the Black community. And Jerry was the first African-American to be full professor at Columbia University, which was associated with Harlem Hospital. All three of those that I learned were watching me. In fact, I was amazed to learn about them, but they probably were even more amazed to see and surprised to see me in the places that I saw them. And they really kind of with a magic hand, I call them like the fairy godmother, the fairy godfathers, because they really followed me around. And I probably would be remiss if I didn't recognize my good friend, the great Dr. Coyness Ennix, who when I came to the East Bay, really sponsored me in a way and indoctrinated me in so many ways, to San Francisco and the East Bay and Oakland. So it's not just one, it takes a village to raise particularly a person like me.
Well, that's so great. We give thanks to God for Ed Cooper, Roland Smoot, Jerry Thompson, and our own Coyness Ennix. So did I say all those names correctly?
Yes, you got them.
Yeah.
That's amazing. Yeah.
That's so fantastic. And that's what I love this year for Black History Month, is kind of highlighting these people that might not make it on a TV special or have a Netflix thing about them, but they were crucial trailblazers, and then also saw you coming up and reached down and made sure, you kind of knew the ropes and just were able to navigate and get to where you are. That's so fantastic. As we kind of wind down, is there anything else you want to tell the church from your position as a doctor what do we need to hear from you? Obviously, wear our masks, wash our hands and all that, but is there anything else?
So get your vaccine as soon as you can. Do it for your family members, do it for your neighbors, do it for the people you see in the grocery store, even the people we hope to be sitting next to us in church soon. We need to do this. It will help us get through this faster. And Lord knows we all want to get through this faster.
That's great. And I'm sure, do you have any tips for people who are still trying to figure out where to get like people who are, say, 70 years old, but are having trouble finding a spot to get the vaccine?
Yeah, it's interesting you say that. And I'll just give you a little story that, my 95-year-old mother, who lives in Philadelphia, I've been wanting her to get the vaccine. And I keep told her to call, her doctor and bug the heck out of him. And she told me, I'm on 3 lists. And fortunately, she was on a list that Black doctors in Philadelphia were, setting up and giving the vaccine. She was on another one at the local community health center, and she was on the one at her doctor's. But last week on Wednesday, she got the first dose of the vaccine by her doctor, so at University of Pennsylvania. So that's on awesome. As many lists. The issue is that there's a priority, and that priority makes sense to have people who are at the highest risk, particularly those who are workers, essential workers, and older adults who really are at the greatest risk of dying. And so we have to respect those rules. But I would say that some places probably they may fill those quotas for those groups and therefore are able to move on to the next priority. And that's really hard to predict in this environment. So.
That's great. Did your mother ever give you grief? Like, what's the point of having a son who's chief of medicine if I can't pull some strings and get the vaccine early?
Yeah. I couldn't pull strings, but I could tell her what to do. And she did what she was supposed to. And fortunately, that all worked out.
And now you're telling all of us what to do. And I think this has been a great sales pitch. I'm 43 years old, so I'm still kind of waiting. And even though I'm clergy, I'm just waiting for me when I get to be a priority. And in the meantime, I'm wearing my mask, I'm physically isolating, I'm going out and exercising, but I wear my mask, and I'm grocery shopping, wear the mask, wash the hands, do the sanitizer, and I'm just waiting for my turn. But I'm also interviewing you to encourage everyone to get the vaccine as soon as possible. So
yeah, and there are benefits to that. I think, as everyone knows, you know, the flu has not been circulating as much this year, and that's probably because of all the, you know, social distancing and sheltering in place, especially for children who aren't going to school, who spread the flu quite rapidly. So it's an interesting a byproduct of what we all are doing.
All right. Well, thank you so much. Is there anything else before we end? I appreciate you taking your time and sharing your expertise in this way a second time. And also just thank you to Ed Cooper, Roland Smoot, Jerry Thompson, and our own Coyness Ennix.
Good. Thank you. Been a pleasure.
All right. Thank you, Dr. Powe. Well, let's finish and just say, in the name of the Father and the Son and the Holy Spirit, amen, and get your vaccine.